Okay, well, let's get started. Good morning. We'll take down the hold slide and welcome you all. Welcome to the Council of the Americas. I'm Steve Liston, I'm Senior Director at the Council in Washington, D.C., and I'm pleased to serve as moderator today for a panel of experts as part of our series of programs looking at a better healthcare future for the Americas. This program is part of our healthcare series, and I want to thank our co-chairs Felicia Knoll of University of Miami and Hugo Villegas of Medtronic for their support and leadership. And I'd also like to thank our 2021 Healthcare Series sponsors, Medtronic, Merck, Pfizer, and Sanofi, for their continued support. Today, we want to focus on the issue of sustainability of healthcare systems in the region as we come out of the COVID-19 pandemic. Many national healthcare systems were already overburdened prior to the pandemic, and dealing with this global healthcare emergency has really shown where the deficits lay. Looking ahead, the demands will only grow. Many critical issues, from cancer screenings to treatment of non-communicable diseases to mental health, were put on hold during the pandemic and now threaten to create new burdens. The pandemic also exposed the vast needs and lack of access that many historically underserved populations face, including rural communities, indigenous and minority populations, women, and of course the poorest among us. At the same time, many governments have had to dig deep to deal with the twin health and economic crises caused by the pandemic. Resources are stretched, debt is higher, and government revenues have often dropped significantly. So how, amidst this new dynamic, do regional governments and organizations ensure the sustainability of their healthcare systems? Sustainability in the financial sense, of course, but also in terms of providing a level of service to their citizens that will ensure a healthy population going forward. What issues do we need to be thinking about as businesses, governments, and multilateral organizations? I'm honored to be joined today by three experts in the field who are going to help us wrap our minds around these challenges. I'm going to provide only a very brief introduction to each, as their complete biographic information is available on our website. Dr. James Fitzgerald is Director of Health Systems and Services at the Pan American Health Organization. He oversees the PAHO work program on health policy and governance, health systems and services organization, human resources for health, financing in health, and access to medicines and health technologies oriented toward universal health. I'm not sure when he gets time to sleep. Although I'm a bit suspicious, his bio says he's been with PAHO for almost 25 years. He has worked with PAHO in Haiti and Brazil, as well as at headquarters in Washington, D.C. Dr. Javier Guzmán is Director of Global Health Policy and Senior Fellow at the Center for Global Development. Javier previously worked with USAID, helping governments in Africa and Asia build their health systems to ensure sustainable access to affordable medicines and pharmaceutical services. He's worked as a physician, researcher, analyst, and policymaker in the United States, the United Kingdom, Australia, and his native Colombia. Mr. Tom Eveson, our third panelist, is Director of Sustainable Finance Solutions and ESG for the Americas at Sustainalytics. Tom leads the team focused on sustainable financing, ESG ratings, performance benchmarking, and impact reporting. He is a founding partner of EMIF Group, established to provide subnational governments in emerging economies with the capital and direction to develop critical urban infrastructure that is bankable for global private capital. Gentlemen, welcome. With that brief introduction, I'm now going to grill all of you mercilessly on how to resolve these thorny issues of healthcare system sustainability, and I fully expect we'll have everything resolved in the coming hour. Seriously, though, our goal is to give you, our audience, a deeper understanding of the issues at play and put out some of the solutions that we all should be considering. I want to invite those of you who are with us today, send me questions via the chat function, and I'll be happy to read them. And if you would like me to identify you as the asker, please be sure to include your name and affiliation. So let me start out by asking each of you, from your perspective, to talk a little bit about where we are today in regard to healthcare systems in the Americas. How have the systems fared through the pandemic? And as we hopefully are heading out of the pandemic, are they in a crisis? Are they strained? Are they in good shape? So James, why don't we start with you, and then we'll turn to Javier and then to Tom. James.
Thanks very much, Steve. It's really a pleasure to be with you this morning. To Javier, a pleasure to see you again. Tom, nice to be on this panel with you. So, you know, from the perspective of the Pan American Health Organization, what we have really seen over the last 2 years is a sustained challenge to health and health systems in the Americas, irrespective of level of income of countries. We have seen that the pandemic has impacted the ability of countries to deliver health services and health outcomes directly as a consequence of COVID-19 and indirectly as a consequence of interruption of essential health services has been significantly impacted. In addition, and unfortunately, the differences in SARS-CoV-2 transmission and health outcomes have been reported by income, quintile, race, ethnicity, and we've seen that excess mortality is higher in lower income, indigenous and Afro-descendant populations. Some studies that we've done here report that the disadvantaged groups are disproportionately impacted through higher COVID-19 infection rates, worse COVID-19 severity, lack of access to treatment resulting in higher COVID-19 mortality rates, and of course impacted by the lack thereafter of access to essential health services. What we have seen is that this is the result of long-standing deficiencies in health systems pre-pandemic. This has undermined the capacity of countries throughout the region to confront and to manage such a large scale and extended event as a COVID-19 pandemic. Frankly speaking, I don't think any country was prepared for this. The most notable issues I think that we've seen that have contributed to the challenges faced by country includes what we call segmentation and fragmentation of health systems. That's basically the high proliferation and poor coordination of subsystems within the health systems, the lack of continuity of care and the opportunity for that continuity, persistently low levels of public investment in health, barriers to access, either administrative, financial, geographical, and gaps in the capacity of the health workforce, particularly at the first level or primary care level. And so all these have historically affected access to health services and effective coverage throughout the region. And we've seen then that as a consequence of COVID-19, access and coverage have, the challenges being faced in access and coverage have been exacerbated. Aligned with this very much is the weaknesses in governance around the formulation and the execution of disease prevention and health promotion policies and strategies, including public health action. And so the region really has been confronted by a tsunami of challenges, very much as a consequence of the lack of preparedness, lack of capacity of health systems to be able to respond. It hasn't all been negative, I would say. What we have also seen is some innovation and accelerated innovations in health systems. You know, we have reported in our governing bodies documents that 51 countries rapidly reorganized and expanded service delivery. There's been a mass adoption of digital health technology, a spurred innovation in human resource management with task shifting and workforce planning across the various levels of the systems. And very interesting new, what we call intersectoral governance mechanisms to improve the leadership and governance, bringing together the private sector and the public sector and the social security sectors to manage flows of resources and the organization of beds and services to address COVID-19 and the other priority health needs. And so there's some innovation there. I think we have a long way to go, but I will stop there as a preliminary intervention.
Just a few small issues to deal with. So we'll unpack a few of those and sort of what's going on in a little bit. But let me turn to Javier, sort of for your perspective on where we stand as we sort of hopefully are rounding the bend on this crisis. Are we heading toward a new one? It almost sounds from what James said that we might be. So where do you see it, Javier?
Thank you. Thank you for the invitation. Thank you to the council and to my co-panelists. It is a pleasure to be here. I think it is important, as James said, to describe the present and the future with a very good view of the region pre-COVID. And unfortunately, the structural conditions of the region have been inadequate for a very long time, problematic for a very long time. And we're talking about inequality, inequity in access to healthcare, vulnerability, social exclusion, social discontent, informal employment, weak social protection systems. And that is not, a very, good starting point. Of course, in terms of the health system itself, there has been underinvestment. There has been, the public sector has underfunded the system for a very long time. And that PAHO said, over 10 years ago that the right public spending on health should be around 6%, and we never got there. And not just that, but on the flip side, what we've seen is constantly a very high out-of-pocket expense, out-of-pocket expenditure, and that basically creates vulnerability, and it creates, a very dysfunctional system to face something as big as the pandemic. Of course, we also see how that underinvestment translated into fewer beds, fewer health professionals, insufficient health promotion, insufficient disease prevention and primary health. And of course, we should not forget that, the risk factors associated with COVID are risk factors that, we haven't tackled appropriately in the region for a very long time. Let's look at obesity, for instance. Obesity was and is higher in Mexico and Chile than in the United States at the moment. Smoking rates. So all these things did contribute badly to the situation in terms of how we were able to face the pandemic. Now, that basically has led us to a pandemic that has had, as you said at the beginning, Steve, hugely damaged both the economy and the health system. Disproportionately, we all know that the region is only represents 8% of the population. However, it is 25% of the global deaths, and we are in a recession with over 6% of loss of GDP. So the system has responded, but it has been a very fragile response, and that doesn't help in terms of the deterioration in terms of people's feelings about the country, the future, the economy, the jobs, how the institutions are responding to the pandemic. And of course, we also have the direct impact of COVID, as I mentioned, that have been measured, and the indirect impact, which is basically something that we are still grappling to try to measure, try to understand in terms of not just the disruption in the provision of health services, but things that we didn't pay attention in the past as much as we should, like non-communicable diseases. I guess I see how the past and the present is very gloomy, and the future is not better. The economy is not gonna improve overnight. We will be asking about more money for health, but that's not gonna be very plausible. So we're talking about additional sources, and we can talk about financing in a minute, but we also will be talking about how we spend the money that we have in a much efficient, transparent, and inclusive way. And then we get into the key issues that are coming up in the region. So we've got where is the political leadership in the region? We see elections happening at the this month in 2022. A lot of countries, big countries like Brazil, Colombia, Chile, all these elections and all these new politicians getting to power will have to face the situation, and will have to make decisions on how this health system and how health is not expense, but it's an investment. It's clearly correlated with the economic the economic situation in country. So all to say, it is not a pretty picture. It's going to be difficult for the few years to come. I hear when James talks about the innovations and the positive angles, and there's a lot that we can do there. But bottom line, I think we as a region and health systems will be asked to do more with much less. And there needs to be a systematic way to make decisions in terms of getting value for money and being able to get health outcomes in the best possible way with the limited investments that we will have. I'll stop here. Thank you, Steve.
Thank you so much, Javier. I'm not sure that made us feel any better, but we'll turn to Tom now. Tom, from your perspective, what does it look like as we're coming out of the pandemic? We will go to solutions soon, but let's ask Tom about where we stand from his perspective. Tom.
Sure. Thank you very much. Pleasure to be here, and thank you all to the members of the panel and audience. Now, my perspective, I do think it's worth pointing out that I am not a healthcare expert. This is not my sector of focus. Where we tend to focus and spend all of our time is on a broad range of sectors, but on the sustainable financing, how does this stuff get paid for and financed, and where is private capital being attracted and how and why is where I spend most of my days. So what we've noticed is within the various regions where sustainable finance in general started with the concept of green bonds. Hey, let's raise money to build a wind farm or a solar park and move more to greener sources of energy or renewable. That was mainly spurred on by the European region. And what we've noticed is in the Americas has been quick to catch up over the last 2-3 years. And in our experience, which is covering everything in North, Central, and Latin America, our team is that LATAM is the fastest growing group attracting sustainable bonds issuers, and whether that is the multilateral development banks, IDB, IFC, really leading the charge there and doing a lot of great thought pieces and work on COVID response and mitigation and access to affordable healthcare, which is the main focus here. So anytime we're talking about sustainable financing with a lens on healthcare, we're talking about access to essential services or affordable healthcare for either marginalized populations, gender-based, actually the UN Women, IFC, and ICMA came out with a piece, I'm not sure if it was yesterday, but certainly very recently, about a guideline of sustainable financing options and lenses to look at the health of women and gender diversity, et cetera. And a lot of that is focused on access to affordable healthcare. So for obvious reasons, we see Brazil and Mexico just by size, economic size, being the leaders in this group, but all of the other countries are starting to issue this more. And again, we can go through some solutions that we've seen. Many of the mainstream financial institutions, specifically in Brazil, have incorporated access to affordable healthcare in their frameworks for their sustainable bonds. We have sovereign bonds. We worked recently on one from Peru that highlighted access to affordable healthcare in there. And I'm just trying to think of some others. And then the healthcare companies themselves, although we searched and we looked, we haven't seen any healthcare companies specifically domiciled in LATAM doing sustainable theme financing, but we certainly have seen the groups likes of Lilly, Pfizer, et cetera, come out with sustainable bonds, socially focused, obviously in those circumstances, looking to improve or finance or fund or support access to affordable healthcare. So if I were to say what is the trend I see, one of the most interesting social bonds and sustainability linked bonds, and I can just, so financing, capital markets in general, my colleagues on the panel here have mentioned private-public partnerships. So what we're seeing is this great vehicle that started as a green mechanism for renewable energy expand into ever increasing new sectors and new use of proceeds and new innovation to attract capital. So there were no social bonds 3 or 4 years ago. They did not exist. There were no sustainably linked bonds prior to 3 years ago. And if I can just highlight the opportunity here, which I think is great, especially as we go into new regions and new sectors, is a use of proceed bond says that I will raise $1 billion in this bond, and I promise to use it for this project, the other project, build hospitals, programs for affordable health care, or to help programs that will target empowering and gender equality for women in these countries. That's a use of proceeds. You say in your launch, this is what I'm going to spend it on. Whereas a sustainably linked bond is based on what are the goals you hope to achieve over a certain time period. So you can use the bond for any general proceeds. You do not have to specifically invest in one thing or the other, but you do have to commit to certain goals. So so in this case, if you will increase the access to affordable healthcare through various programs, targeted communities, then that will be a goal. So how you go about that will not be as tightly controlled or tightly reported on, but you will have annual goals to meet to increase that access. And I think that's a very exciting trend. And I can go through the numbers when we get to the solution phase. Thank you very much.
Well, I think you've gotten us there. I feel a little bit better having heard from you, Tom. And the reason we wanted to bring you into a healthcare panel is precisely for this, to understand some of the things that are out there that are going to help with the problems that James and Javier, identified as being enormous problems. But given that this is a healthcare panel and a general audience that the council attracts, maybe you could talk a little bit. You gave us a little bit of a shape of how these work, but why now? Why the last 3 to 4 years? And is this going to accelerate? And if I'm a government in Latin America that wants to do this, how do I take advantage of that? How do governments, plug in? And then who monitors that? Who makes sure that hospital is built or that those goals are met as we go forward? So let's move kind of to solutions. We obviously are in need of them. And let's start with you again, Tom. Just stay with this topic a little bit.
So why now? I'm asked that question often, and I can become a little broad thinking and philosophical here. I just think in general, all aspects of our life, whether it's personal, whether it's in our homes, whether it's at a community level, a national level, a social level, government level, or corporate level, transparency and accountability is increasing. It all started with the internet. It started with the printing press. It started with cameras and videos. Things that go on behind closed doors or that nobody knew about are just slowly going away at an ever increasing pace. So when you've got now here in 2021 going into 2022, politicians, governments, corporations, poverty, inequality is all being laid bare to see. So I don't mean to go through the history of the world and just social governance, but I'm seeing this in all aspects. People are being held accountable in their workplaces. People in higher places of power are being held accountable for the actions of their government or their companies. So I'd say this all plays into it. Obviously, we have more data and we have more transparency, and I'd say sustainable bonds and the access to information is just a result of that increased awareness globally. I think it's exciting. I can't say I can pinpoint. COVID certainly helped. We have events that spurred it on, but it was coming anyway. So I say this started 7 or 8 years ago, and I can just look at a few stats here. So we've now got upwards of a few hundred bonds that have been launched in Latin America, with, again, Mexico and Brazil, Chile leading the group. and others are at 1 or 2 or 3, the smaller countries with smaller economies, but they are coming. And if I were to see the number, so we only had about 30 or 40 back in 2014, and now we're doing about 50 a year. And in total, we're well over a couple hundred in bonds, whether that's social, sustainable, or sustainably linked, or green, where social and sustainably linked are taking the lead. That's just innovation. I think, well, if you've got a whole global community of private capital and investors, even at the retail private investor level, saying, I want my money to mean something. And they're going into the funds that are being allocated towards these things. You have new asset management mandates. So the typical mutual fund before would have invested in growth stocks, LATAM stocks, small stocks, big stocks, European stocks, healthcare stocks. And now they're all launching mandates to invest in sustainable or impact related stocks or bonds. And the number of fixed income bond investors at the institutional level that are launching focused, sustainably themed bond funds is increasing daily. So it's a trend. It started small, and that's what's happening now. COVID certainly spurred that on. Climate crisis is certainly spurring that on. And I have to give credit to the multilaterals like IFC and IDB, UN SDGs, all these initiatives. They are really helping to pave the way to encourage this. And I'll pause there to let others speak. Thank you.
Super. Thank you, Tom. Let's zoom out a little bit, Javier, and come back to you. And just, you've got a very broad experience around the world as well as in the region in terms of what these policy priorities need to be. We've heard something about the financing. You might want to discuss that. But also, governments are facing a huge, especially in developing countries, they have a huge number of priorities they're trying to address. Where does healthcare fall? What are the things that they should be focusing on to try to overcome some of these problems that you and James have identified? Where do you see the biggest sort of, or maybe the lowest hanging fruit, or the biggest bang for the buck in terms of things that governments should be focusing on as they look across the range of these issues that they have to address?
Sure. So let me just talk a bit about the financing part. So we've got two parts, of course. You have the revenue generation. You need to have, you need to collect the money, and then you need to spend the money. And we've heard from Tom about possibilities to raise money, right? And I want to talk a bit about how the countries are really struggling to collect taxes. So in terms of being able to collect revenue and being able to expand the pie, that's not easy. So 2 or 3% in the past year or so. So that is one aspect, and on that aspect, I think in terms of what you're saying, the low-hanging fruit, the biggest bang for the buck, I think one angle that hasn't been considered is tax increases on things like tobacco, alcohol, sugar, sweetened beverages. These health taxes could really be killing two birds with one stone, because on one hand it will raise revenue, and according to some estimates we've done, it could actually be half of the revenue that has not been collected during the pandemic if you increase those taxes by 50%. And two, it will have a very positive effect on non-communicable diseases, on prevention, that has already been demonstrated. So I think that would be a very important, biggest bang for the buck. Now, the second aspect is to maximize the value of that money that you're investing in health. And in that, of course, we're talking about a lot of conversation about disease prevention, promotion, primary healthcare, and that needs to happen because, the investments into healthcare could actually be on intensive care units, which was important at the time, but going forward, is this the biggest value for money? I guess, bottom line, countries need to be very specific about their priority setting systems. the best way to assess the bang for the buck, the best way to assess the cost and the benefit of the different investments. And on that, I think you at the council and the companies that are, supporting this event have been very keen on results or outcomes-based payment models. And I think that is another, possibility, low-hanging fruit, paying for performance, paying for outcomes rather than paying for inputs. And we, in the past might have said, Latin America is not there, the region is not there, we don't have, the information systems in place. But if you look at examples like, for instance, hepatitis C, the medicines for hepatitis C, and the case of Colombia, for instance, in Colombia, they have been able to not just identify all the patients, be very specific about the protocols to, prescribe the medicine, measure compliance, measure adherence, measure outcomes. And that basically is the data that is needed to pay for performance, to pay, outcomes-based payments. And the third point I would say in terms of this maximizing the value for money is, reducing inefficiency. And that means, how we can be more efficient in terms of regulation, in terms of procurement, in terms of, quality. And you have there, the big possibility of, facilitating the entry of biosimilars, improving access to, quality assured generics, and things like that. So I see, possibilities. One point that hasn't been discussed a lot is what's the regional approach to it. So when I say, regulation or procurement, you can talk about it at the national level, and there's a lot that can be done, but there's a lot that could also be done at the regional level. And of course, we've seen the role PAHO has played, but the path ahead, is still very, open and needs to, we need to leverage those assets that we have as a region to benefit those efficiencies at the country level. Thank you.
Thank you, Javier. That was a great lead-in for James. So I want to turn there now. James obviously is representing the government organization par excellence that deals with healthcare issues in the region. And what we've heard from Javier is there is a big role for governments that doesn't actually require huge amounts of money, right? I mean, there's a role in terms of the way assessments are done, in terms of the way the bureaucracy is organized, that is really important, both at a national and a regional level. And so I want to ask you about what's going on at that regional level. What are governments talking about? What are they doing together? And I'd like to throw one curveball in there. We have a Summit of the Americas coming up next year. And we know that there's an interest in, for obvious reasons, in putting healthcare, up front at that summit, which makes all the sense in the world. But we don't just want to deal with the current pandemic. We want to look forward in that. So where do you see governments wanting to go at that summit, both generally in terms of your work and at that summit, and where do you think that we should be going as a region in terms of what governments are doing?
So yeah, that's a great question, and that was a question that was posed actually to PAHO about 6 months ago. So our countries, our member states, asked us to begin to do some work to see, okay, in the short term scenarios, what do they look like? Longer term, what are the options? And we've done some work around that. Most recently, I think the joint publication with the Economic Commission of Latin America and the Caribbean on the 6 to 9 month scenario analysis of the pandemic and the context of health systems within a very, very precarious context of rollout of vaccines. And I mean, I think there's so much in that document that I think I would urge all participants here to have a look at that. But in terms of the beyond the 9 month scenario, we presented and we worked with countries on a proposal that they adopted in our governing bodies meetings in September around the need to really begin to focus on the issue of resiliency. Resiliency in terms of social protection, resiliency of health systems, and using this to kind of as a platform to accelerate the recovery and to sustain and protect public health gains it's very important to note here, we see a loss in terms of public health gains in the order of 10 years. The initial indicators coming out suggest that we've lost 10 years in terms of the critical health outcome indicators in the region as a consequence of the pandemic. So when we talk about recovery from the health systems perspective, what does that actually mean? And so in the dialogue with countries, there was, first of all, a call for transformation, a real focus on the need to begin to look at health systems, how to transform those health systems, addressing what we talked about at the beginning, the structural and organizational issues, the capacities or lack thereof, to facilitate and accelerate recovery in the short term and to ensure sustainability and preparedness in the medium to long term. That was a central message, I think, of this approach. And the central strategy around that, Steve, is it's nothing new. It's primary health care. Most of our health systems in the region remain very hospital centric, with the shifting of resources into tertiary care, where if we allocated a higher level of resources to primary care, secondary care, and the organization of health networks, we think we would see a considerable increase in terms of value for money. And that's why PAHO is not only recommending that countries invest 6% of public financing, to increase public financing to at least 6% of GDP, but of that, we are telling countries now to at least allocate 30% of those resources to primary care. And it's very interesting to see, you know, initial results and analysis of countries even suggest that the average is in the order of 18 to 22% at present. So that's way below what it should be. That's really indicating that essentially 80% of the resources are being allocated to either secondary, more complex, or tertiary complex delivery of care. And that's not where the resources should be if we're really looking to improve health outcomes, sustainability, and resilience in the future. In terms of the health financing itself, we believe that countries need to begin to focus their investments in areas around primary health care and the integration of care at that level. In public health interventions, strengthening public health capacities, in infrastructure and ancillary services, including health and digital technologies, in properly educating. There's a disjoint also between the education and labor sectors with the health sector, and really begin to realign the needs of the education and labor sectors with that of the health. The education and labor sectors are seeking more higher qualified specialists and for hospital care, whereas in fact we don't have sufficient primary healthcare physicians in the Americas to address needs. I think it's important we pick up on something that Javier said also. There's a real need for countries, and this is not within the health sector, but more within the financing sector, to address the gaps in the ability to collect taxation, to look at the issue of fiscal space, to analyze that and to identify efficiencies to increase that fiscal space, to improve pooling of resources and capacities in planning and financial management for health systems. All of this is very important to not just to improve efficiency, but also to reduce what I mentioned at the beginning, reduce the levels of segmentation in terms of the financing. And here we believe the IFIs, the World Bank, the IDB, CAF, etc., have an extremely important role. And we're working very closely with them at this point in time to make sure that the health authorities have a seat at the table. What we've seen in many health sector reform processes is that health is on the table, but not participating at the table. So in other words, the health as a social sector is being first put up for cuts and reductions, whereas we've seen a pandemic like this means that we could be ultimately impacting the preparedness of that country and the economic resiliency in the future by doing so. And so we're having significant dialogue with the IFIs around that. In terms of the Summit of the Americas, we're working closely with the OAS. We are participating in a number of their sessions. You will note that the OAS issued an important resolution last week on the pandemic. around health technologies and production platforms, etc., that we are moving forward with, around the transfer of technology into the region, particularly for mRNA health technologies, and for better coordination between the multiplicity of sub-regional initiatives that are ongoing. Javier is right in the sense that the region is highly fragmented at the moment politically, and so that it's very important that we continue to play our role as advocate for a whole of region approach in this area, and as such, the Summit of the Americas is critical. So we see the Summit of the Americas really focusing on three key issues: resiliency and recovery in terms of the health sector and its linkages with the economic and social sectors. Broader issues around climate and the economy, and then really homing in on the capacities in terms of production, research, development, and production. We see that these three areas will be central to the Summit of the Americas, and we're working very closely with the US and the OAS on this. Thanks.
Thank you very much, James, and we'll have to come back to that at some future date when we know when exactly the summit's going to be. We'll come back and talk more about that with you all, because I think those are very broad topics, and obviously we could spend well over an hour just on those. What I'd like to turn, we've been focusing on governments for the most part in terms of what their role is. I'd like to turn to the private sector, but before I do that, I got a question, and Javier mentioned it, and I'd like to just focus on this question that is really of importance to a lot of our member companies, which is regarding value-based procurement. I'd love to hear what the three of you think about that. Is it being implemented? Is it part of the solution? What kind of knowledge, capabilities, change management would be required to make it happen? Is there any effort at a regional level to help governments that want to implement such system put it into effect? And should it be put into effect? So, James, why don't we start with you, and we'll go back through and just ask your opinion of that, and then we'll turn to the private sector issues I'd like to touch on before we close. James.
So the issue of procurement, I think we need to be very clear about what we're talking about when we talk about procurement. It's essentially the contracting of services or goods by a national entity or at the regional level to respond to a specific need. The concept of value-based procurement is not something that in particular we have been focusing on per se, because what PAHO essentially does is respond to the needs of member states and their priority public health programs through a regional approach based on principles of quality. So when we talk about value, quality cannot be on the table. Here we need to look at the eligibility requirements, quality, safety, and efficacy of products that we are purchasing. We need to look at the overall efficiencies and the economies of scale so we can achieve. And then we need to look at how those health technologies are actually deployed within health programs. I think, first of all, we really need to focus on the issue of what technologies. And here, I think the region has made very important gains, including, I would say, Javier, Colombia, in terms of health technology assessment, to guide the processes in terms of the decision-making to assess the cost effectiveness of health technologies for incorporation into health systems. And we've seen that in terms of the new vaccines coming online, or potentially some of the new biosimilars that are being adopted within public health programs. Thereafter, the whole process, as you know, PAHO has two major mechanisms. One is the revolving fund for vaccine, and the other is the strategic fund. Between the two of them, we essentially supply over $1 billion worth of vaccines and medicines and health technologies to address the public health program needs within the Americas. Some of the challenges I think that we continue to face as we move forward relates to the planning process, the alignment of planning processes with budgetary processes at the national level. And here we're talking about the efficiencies that need to be achieved. The second issue really relates to the what technologies, because we don't have a broad consensus in the region around what public health programs want. There is a general list or essential list of health technologies, but countries are really facing challenges in terms of some of the more specialized high-cost technologies. And that's a very complex area in terms of moving forward, in terms of a regional pooling of procurement. And then thereafter, you know, as we look at the deployment of COVID-19 vaccines that are being purchased either by the organization or through COVAX, one of the enormous challenges that we have is to align the processes with the post-marketing surveillance. That involves the active participation of national regulatory authorities to provide information around possible adverse events. And this is, more broadly speaking, is how we work. We don't see procurement as a process per se, but we see it as an integral part of our technical cooperation, where we have to bring in the national regulatory authorities. We have to address the issues of quality, safety, and efficacy, and we have to address the program priorities in each of these areas. We feel, just to finish, we feel that we have an enormous platform for the region to move forward with, particularly in vaccine production moving forward, whereby if the region can begin to increase its vaccine capacity in terms of production, we can align that with the quality systems that we have in place and with the regional pool procurement mechanisms that we have in place, so that we're much better prepared for the future and ultimately for the next pandemic.
Thank you, James. And just so make sure I'm clear on this, my understanding is value-based procurement is as opposed to sort of cost-based procurement, right? Which is to say, instead of just looking at what's the lowest cost option, we're looking at what's the value we're going to get from that particular technology, that particular vaccine. So it may be that something that costs more is actually more effective at doing what we need it to do. Is that an issue? I mean, are places still that you're looking at, you know, sort of what's the lowest cost option, we'll buy that and not worry about, you know, the outcomes, or is that something we're overcoming?
So, I mean, so that, again, that's why we don't talk about value-based procurement. What we talk about is health technology assessment and a look at cost effectiveness vis-a-vis a treatment. And then if that is the right decision for a country to move forward, we'll move forward then with the procurement. Okay. So we separate the two because we don't want to link the decisions relating to evidence, cost effectiveness with the actual market analysis and overall procurement process. Okay,
so it may be slightly a semantic issue, but it's right. that issue of effectiveness and not just going for the cheapest solution in the short term. Okay, Javier, let's turn to you on that question.
I guess a few points on that. The first one is, I understand the question in relation to the adoption of new innovative technologies, like new molecules, new technologies that are coming to, you know, the region. And I see how there's a lot of pressure on the systems to adopt these technologies very quickly, and that basically creates, you know, issues with sustainability. So governments and systems do need to be smart in terms of deciding what to buy and what to pay for the different, you know, innovations. Now, James talked about health technology assessment as a way to discriminate, you know, between the cost, meaning the price, but also all the other costs associated with a condition, and the benefit not just in terms of, you know, the clinical benefit, but also, you know, all the benefits that are associated with, you know, improvement. And I think that is a good way forward. So, you know, being able to discriminate value in terms of the benefit versus cost. Now, the problem now, the additional problem is that it's no longer going to be just about cost effectiveness. Now, we will also need to talk about affordability. So it could be extremely cost effective. It could be good value for money. But if you don't have the money to pay for it, then even the most cost effective option is not going to be plausible. So I think that is one point. The second point is, I do think that, you know, governments and systems have been developing at different speeds in terms of, incorporating new ways to procure, new ways to buy. And of course, the holy grail is, aggregating demand and do, a very good, arrangement in terms of predictability, in terms of saying, this is how much I want to buy over this period. And, with that big volume and longer term commitment, you get a lower price. Now that it is possible, doable, and necessary at the regional level. And I think the strategic fund has done, has provided a great example of that. The question is, what other medicines should be procured at the regional level? What other medicines should be included within the strategic fund? And at the moment, it's about like 250 million what the fund procures every year. So it's not a lot of money. But if we focus on these high cost, expensive medicines that might not provide a lot of value, the opportunity cost, the other medicines that are not being included are medicines that are very cheap and do need to be included in the vertical program. So I think, that needs to be taken into account as well. We see a lot of, and that's a challenge, a lot of, vertical programs with small volumes dealing with, infectious diseases, leishmaniasis, Chagas, and the only way to procure is by aggregating demand. So I guess the point there is, yes, let's look at the regional procurement in terms of new technologies, but don't forget that there might be an opportunity cost in terms of leaving out very cheap, important technologies. But I guess in terms of, measuring value, I do think it's needed. I do think it's important. I do think payers need to be able to discriminate between value and value, not just price, but value in terms of what it means. And that needs to have a proper priority setting system in place. So health technology assessment agencies and units have been created and should be supported. And they should be working hand in hand, regionally to avoid recreating the wheel. So we have the lesson of, the regulatory agencies, every country has developed their own regulatory agencies, taken many years. And now, is the moment when we talk about how do we do, things together, reliance or harmonization, because it's not easy. But with the health technology assessment conversation, the progress is not that far. So that conversation could take place earlier on. So how could, for instance, do an assessment of the molecule for a couple of countries and understand, both the costs and the benefits of that molecule in those systems? And that basically means efficiency. That basically means being able to pay for value. That basically means an orderly adoption of new innovations. Thank you.
We've got about 5 minutes left. I'm going to turn to Tom. If you want to tackle that question, you may, but I also am going to throw another question at you so we can move straight into the last thing I think we're going to be able to cover, which is private sector. In my own head, I divide for this conversation three types of members we've got. We've got obviously healthcare companies, we've got finance companies, and then we've got general investors, employers, companies that obviously want healthy workers. They want to see their healthcare systems thrive. So I'd love for the three of you, and we'll start with Tom, to just talk about what is the role of the private sector in all this, and particularly how can private and sector work with governments? How should they be working together to resolve some of these issues that we identified? Tom.
Sure. We could go on this for a couple more hours easily, but it's let's just take out the bond financing. I just encourage everyone to be innovative. Go country by country in LATAM. The corporate issuers of these sustainably themed bonds and their programs and what they promise to invest in and use it for is being led by the corporate sector. Sovereigns are government bonds are next, but yeah, the corporations are still the lead. A lot, like I said, anyone in the pharmaceutical or healthcare industry, a lot of it is promising to invest in access to affordable healthcare. But then what on the ESG level, quite honestly, I didn't come to Sustainalytics because I grew up saying I was going to be involved in sustainability and ESG when I grew up. I come from the capital markets world, the corporate world, and I ended up here. And I am shocked how material an ESG rating has become to a company's ability to access capital and use capital. And you've got the whole global world and governments and regulators saying, ESG matters, and severe risk or high risk is becoming uninvestable by a lot of asset managers who are signing on to these initiatives. And healthcare and employee healthcare is one of those. So if you want to have a good governance position, if you want to have a good corporate citizenship profile that is now becoming material and ranked and regulated as an ESG score, invest in your employees, invest in their healthcare, invest in better corporately sponsored health programs for your employees, especially on the marginalized communities like women. We have lots of materiality KPIs that I'm happy to share with any company that wants to look at it. And we're not the only ones who do this. There's a few big companies looking at this. Private corporations can definitely do a lot. And I just in my other world on EMIF Group and infrastructure development, I just want to say one of the biggest initiatives I've seen over the years is you have the whole public-private partnership investment world saying, how do we close this gap? And you have everyone saying they're trying to invest in climate change and impact, but you still have this mad rush of all the big institutions, pensions, et cetera, in the Northern Hemisphere saying, yes, I want big national sized utilities and ports, and I want to invest in those. And it's overcrowded capital chasing fewer and fewer assets for these. But what we are seeing, like the initiative I'm involved in, but by far not the only one, increasingly people are trying to figure out how can we do the same that we've done with national and state governments at the sub-state level, at the municipal level, at the regional level, and help fund public-private partnerships for infrastructure development, including healthcare and hospitals and healthcare at the sub-state level. So I'd say overall there's a lot of trends there, and private corporations, which was your original question, for sure can lead in their own internal performance, and they can definitely take advantage of a lot of high profile publicity by being leading ESG citizens and taking care of their own employees and investing in community healthcare. I'll pause there.
Thanks so much. I'm sure James is happy to hear that as well. So James, you have thoughts on the private-public cooperation and what you'd like to see from your PAHO perspective from corporations?
Yeah, most definitely. You know, some of the work that we've done with ECLAC is really around the analysis of the capacity of the region to respond to its needs in terms of health products, medicines, and health technologies. You know, when we issue bids for either the strategic fund and or the revolving fund, we have a very low participation from the region. And I think, you know, when we look at the data that we collected with ECLAC on the capacity of the region to respond to its own needs, we found that approximately only 4% of health technology needs are being addressed through regional sourcing, which means the dependency of this region, Latin America and the Caribbean I'm talking about, the dependency on global supply chains outside of the region is in the order of 90%. The level of vulnerability of this region is just too high. So I think we really need to push this agenda, the participation between the public and private sector around research, development, production, bringing the various sectors together, but having the private sector and you know, having discussions around innovation clusters that other countries have developed with public-private sector engagement on it. I think this is really becoming a priority for the region.
Thank you. And not to put too fine a point on it, but investment climate plays big here, right? Companies need to create investment climate that's going to be attractive to private sector to invest. Javier, I'm going to give you the last word on this issue of public-private and the role of corporations, the role of companies in this issue.
Yeah, no, I think an very important point is, you know, the research and development capacity in the region and the ability to, you know, leverage that. You know, we've seen how the clinical trial capacity has been, you know, growing in the region, but it's not where it should be. Also, in terms of, you know, what James was talking about, creating innovation hubs and being able to, manufacture in the region. I think that is extremely important. We've seen how the geographical concentration of manufacturing of all these vaccines did have a big factor in how the region was not able to access any technology, any medicines at the time, and that is something that shouldn't happen again. So I know there has been a discussion in terms of creating hubs in Brazil and in Mexico, but that is important in terms of aligning those with the procurement and aligning those with the value chain and going to end-to-end supply chain to be able to not just be more self-reliant but more prepared for any new external shock that we might have. And so this conversation we're asking about what is top of mind for policymakers now is about emergency preparedness. And if we don't seize this window of opportunity to make these changes, it will be inertia, and it will be very sad to have lost a crisis, a pandemic, and not have done what we should have. Thank you.
Yeah, fool me once, shame on you. Fool me twice, shame on me. Right? We've all seen it. We've all seen it happen, and it would be irresponsible for us not to deal with it. Well, we're out of time. I feel like we opened the door to about 30 other topics we could spend an hour on, and so maybe we will in the future find some of those to do. I really want to thank you, all three of you, for being with us. James Fitzgerald, Javier Guzmán, Tom Eveson, thank you for joining us. I want to thank our healthcare series sponsors, Medtronic, Merck, Pfizer, Sanofi, for making this program possible. And I feel like I've come away at least with a huge understanding that there are many things that can be done. Yes, there's a financing issue, but there are many things that can be done if we work together as a region with PAHO, with IDB, World Bank, others, and if governments are determined to create the systems necessary to take advantage of these things. The information is there. We need to work together to do it. So thank you for that. I want to invite all of you, before we close, to join the council this coming Monday at 9:15 for the next virtual session of this series on a better healthcare future for the Americas, when we will have a conversation with Dr. Fernando Ruiz Gomez, Minister of Health and Social Protection of Colombia, regarding Colombia's efforts against the pandemic and efforts to ensure a sustainable healthcare system in that country. So thank you again, gentlemen. Thank you, all of you who joined us today. This will be on our website soon, so look for it there. And until we see each other again, stay healthy, please, all of you. Thanks so much.